Hi, I'm Dr. Nadav Pam. I'm the clinical director at Formatk. Today we are going to speak about hair removal with laser for men and what you really need to know before starting the treatment. Laser hair removal for men is not always the same as for women, not in the terms of hair structure, skin response, or level of pain and potential side effects. In this video, I will name the 6 most important tips of what you need to know before starting to perform hair removal with laser on male patients to help you achieve safe, effective, and comfortable results. Let's begin with the pre-treatment instruction. It's recommended to shave for men 24 hours before the hair removal of laser, especially in the area of the face, neck, and nape. The shaving of 24 hours before the actual treatment improves the absorption of the hair follicle's energy and reduces discomfort during treatment. When you shave 24 hours before, you have a small antenna that picks up the heat transfer into the dermis, where the heat will meet the chromophore of the terminal hair follicles in anagen and will achieve hair destruction. Before the treatment begins, and after filling out informed consent by the patient and reviewing the history and medicines that the patient is taking, if it's taking, it's important to diagnose the skin type according to the area that you are treating. We can achieve it using the Mylo, a melanin meter that detects superficial and deep pigmentation. Not only will it detect the pigmentation in the skin, it will also detect the pigmentation in the hair follicle and take it into account by choosing the skin type that you need. Therefore, the parameters that you will choose with your device will be set accordingly, both for the hair density and for the chromophore of the skin itself. By choosing the correct energy setup using the melanin meter, we get several benefits. Once we can choose the recommended fluence for that exact area, we can choose the correct method that we need to treat, and we can get more safety. In the market, there are several different lasers. In our particular case in Formatk, we use diode laser with 808 nanometer wavelength that targets melanin in the hair follicle, usually in mid-dermis. The energy will be absorbed for the terminal hair follicle with high efficiency, and therefore it will achieve hair destruction. In men, the hair follicle diameter on average is thicker than females. Therefore, it means it contains more melanin. Therefore, we have to take that into account by choosing the energy setups that we want to do in the treatment. Darker hair absorbs more energy, which can lead to enhanced clinical results. Facial hair in men, especially in face and neck, tends to be more thicker and much more denser. Therefore, we need to take that into account. Even if you are skin type 1 or 2, but you have dark hair and it's very, very dense, the melanin meter will help you detect and choose the correct energy setup to achieve the best optimal results. Male hair requires adjustment in treatment for several parameters: fluence, pulse duration, hair density, and hair color, and skin type. Usually for males, they have high nerve sensitivity in the treatment areas. Our body has different proportions of nerve endings in different anatomical areas. However, in the face, in the neck, in the back here, we have more receptors, and usually the male type feels it as more intense for the hair removal treatment. Before any treatment with male or female, especially in a new patient, you must perform a patch test. A patch test is applying one pulse of energy in an inconspicuous area, and therefore you need to wait according to the skin type. In skin type 1 till 3, the time for complete results is usually up to 1 hour. However, in skin type 4 and above, it may take up to 48 hours due to delayed response. So this fact needs to be in consideration when choosing the correct setup for the parameters. There are unique characteristics of hair of the face and neck area. They are exposed daily or weekly to shaving, sun exposure, and constant irritation, which increase the potential of local inflammation.